Coroner issues warning after man, 28, given fatal COVID jab because of GP data blunder. Reid given Oxford-Astra Zeneca vaccine despite danger to under 30s as NHS thought he was morbidly obese. A coroner has issued an official warning over the death of a healthy young man wrongly given the Oxford-AstraZeneca vaccine because of a medical blunder. Reid, 28, was invited to have his initial jab in March 2021 because of an error in his GP records which had wrongly classified him as morbidly obese. It meant he was vaccinated early as a vulnerable adult. A month before official advice was issued saying that the under 30s should not receive the AstraZeneca vaccine because of the risk of blood clots. Mr. Reid died 3 months later after receiving his second dose of the vaccine, and a senior coroner has now issued a warning about the reliability of health service data. In a Prevention of Future Deaths report, Oliver Longstaff, area coroner for West Yorkshire, said if the data had been accurate Mr. Reid would not have died. The inquest was told that Mr. Reid was identified as vulnerable due to an incorrect BMI recorded in his GP records from February 2004, when he was aged just 11. The mistake was due to the relevant clinician recording Alex's height as 145 centimeters and his weight as 145 kilograms, giving a BMI of 68.97 for an 11-year-old boy whose previously recorded BMI aged 9 had been 14.88, Mr. Longstaff said. As a result, Mr. Reid, an operations controller from Leeds, was invited to receive his COVID vaccination earlier than his age alone would have entitled him to do so. On March 21, 2021, Mr. Reid was given his first dose of the Oxford-AstraZeneca vaccine. Mr. Longstaff said, when Alex was invited to receive his vaccination early, he did not understand why, and no one was able to tell him. Just 1 month later, official advice was issued that stated people under the age of 30 should not receive the Oxford-AstraZeneca vaccination as their first dose. The government's vaccine advisors had recommended that recipients under this age should receive alternatives to AstraZeneca because of the risk of blood clots. In May, Mr. Reid received his second dose of the vaccine. He was given the AstraZeneca because he had already had the vaccine as a first dose. On June 29 in Leeds General Infirmary, Mr. Reid died of a blood clot on the brain. The coroner recorded the cause of death as vaccine-induced immune thrombotic thrombocytopenia, a new condition linked to the AstraZeneca vaccine that is suspected of causing more than 80 deaths in the UK and hundreds more serious disabilities. Mr. Longstaff recorded a narrative conclusion, reflecting Alex's death being linked to his having received the Oxford-AstraZeneca vaccination against COVID-19. Alex would not have died. The coroner said, if the obviously erroneous BMI had not been recorded or had been challenged at the point of entry by the relevant IT system, Alex would not have been classed as vulnerable, would not have been offered a vaccine before guidance was published that the under 30s should not receive the Oxford-AstraZeneca vaccine, and would not have died when he did. Mr. Longstaff wrote to the National Chief Clinical Information Officer and Chief Information Officer of NHS England amongst others. In my opinion, action should be taken to prevent future deaths, and I believe you or organization have the power to take such action, he said. Each organization has 56 days to respond to his recommendations. Mr. Longstaff's warning comes after AstraZeneca admitted for the first time in court documents that its COVID vaccine can cause a rare side effect of blood clots with low blood platelet count. Mr. Reid's distraught parents have previously told the Telegraph of their distress. They said their happy, healthy, precious and beloved son's death was unacceptable, immoral and fundamentally wrong, and accused AstraZeneca and the government of ignoring the small number of people who died or were seriously affected as a result of the blood clots in order to quickly roll out the vaccine during the pandemic.